Good morning, Arizona, here at 9 o'clock on your Thursday morning. Our top story, of course, coronavirus concerns. Travelers changing their plans as that virus spreads.
Several airlines taking precautions when it comes to cleaning their aircraft and screening passengers.
Erin is live from Sky Harbor this morning with more on how people are dealing with this concerns. A lot of people worried. Erin, good morning.
Yeah, it's basically on the minds of a lot of travelers here today, those preparing for spring break and even those looking forward to family vacations during the summer. But I actually spoke to representatives here at Sky Harbor, and they tell me that they have not so far been asked by public health officials to really make any specific changes due to the coronavirus outbreak. However, though, we do know that the CDC has already issued several travel warnings due to the coronavirus, basically asking people to avoid unnecessary travel to places like China, Hong Kong, South Korea, and even be extra careful traveling to places like Iran, Italy, and Japan. Now, a travel agent we spoke to says, here's some of your options if you suddenly have to change your travel plans. Check your itineraries and look over those cancellation policies, as well as if you do get traveler's insurance, make sure that the policy, you can cancel it basically for any reason. And like I mentioned, travelers here at Sky Harbor were basically split on how they feel about this whole coronavirus thing.
I don't really have any concerns traveling. I'm staying locally in the U.S., so it should be fine.
Certainly, it's on my mind all the time, and I'm carrying antibacterial wipes with me, so wiping down the area of the airplane where we're sitting. They say to do that, so taking all the precautions I can that I know.
And again, if you are at any time concerned about any specific travel destination, you can head to the CDC's website, enter in that location, and they'll go ahead and give you some recommendations about whether or not you should be traveling there. Reporting live at Sky Harbor, I'm Erin LeBeau for Arizona's Family.
Good information, Erin. Thank you. And Arizona's Family reached out to several major airlines to see what they were doing about these concerns. American Airlines sent us this statement. Our aircraft, including lavatories, are cleaned on a regular basis when ground time allows. Galleys are cleaned, tray tables too. Transcontinental, Hawaii, and international flights see an even deeper level of cleaning that includes cleaning of lavatories, tray tables, and galley areas, as well as any surface areas throughout the aircraft. Floors are also vacuumed. Other major airlines are taking similar precautions.
All right, let's go to Wall Street, show you what the Dow is doing this morning. Earlier, it was down over 900 points, 3.25%. It's backed off to just over 500 points. All three major U.S. indexes are now on track for their worst week since the 2008 financial crisis. We went from record territory to correction status in a matter of 10 sessions.
Time now is 9:03. So how bad is the coronavirus outbreak and how do you prepare? The World Health Organization says it has pandemic potential but has been steadily declining. Meanwhile, the mayor of San Francisco declaring a state of emergency in the city to prepare for a potential coronavirus outbreak. So should we be worried or not? So let's talk about it in practical terms so we can all feel a little bit better about our health in general. Dr. Sharon Thompson is joining us today with some precautions to take. And, you know, I assume, like all things, we shouldn't be overreacting.
We should not. So coronavirus is a family of viruses that we know. These cause colds in this season of the year. And this one, though, is a new one. So we have to figure out the factors, the characteristics of this new virus. But we shouldn't panic. There are folks who are well trained at the CDC and the WHO, the World Health Organization, who are taking care of this part of the outbreak.
Okay.
What you and I can do is our usual precautions. Okay. So I know lots of people are buying masks.
Yes. So
and
what do you
wiping
make of all
everything
of
down
this?
with Lysol and spraying. These things don't work against viruses.
Is that true?
The things that do work and will help you is the things we talk about all the time. Good hand washing.
Okay.
Good hand hygiene. We spread viruses by touching our eyes and our nose and our mouths. And so if we wash our hands and keep those clean, we're less likely to transmit virus.
Adopt the protocol of a doctor, which is always wash in and wash out, right?
Wash in and wash out.
Okay.
That's fantastic. If you're coughing or sneezing, definitely use tissues or sneeze into your elbow or shoulder to avoid spreading droplets to people in your environment.
Okay.
And you might want to wear a mask if you are sick to prevent whatever you've got from
Okay.
spreading. But coronavirus is not widespread in the United States.
Right.
There have been about 53 confirmed cases. Most of those have traveled to the region of China that we're concerned about, or are close contacts of people who have traveled. So only one with an unknown source, and the experts are still working on that case. So most of us don't have anything to fear.
Yeah, it's funny because it's so unusual. It used to be so unusual to see somebody with one of these masks on, but now you're seeing, at least on social media, more and more images popping up of that. So in any case, would that be protective of something like this?
So if that person is ill, yes, it'll protect the rest of us from getting what they've got. If you don't have anything, then 9 times out of 10 we use the mask incorrectly. There's gaps between our nose and our mouths. We touch the mask frequently. We're constantly touching our eyes and nose, and then that's conferring no protection whatsoever. So most people who are using masks are not using them correctly, and they're not the right people to be using the mask. The person who's sick is the best one to put the mask on. Or the exception is if you're immunocompromised.
Yes.
So if for some reason you can't be vaccinated or you know that you have an immune condition, then you may want to wear a mask when you travel. And again, coronavirus isn't your biggest worry. It's all the other things that we all
And right now we are still in the middle of cold and flu season.
We are in the middle of cold and flu season, so get your vaccine if you haven't gotten it already. Because flu, there have already been over 15,000 deaths from flu in the United States. Versus coronavirus, 0 deaths.
Yes. Yeah, that's incredible perspective because we really just get used to the term influenza and we don't worry about it quite as much, but it is pervasive. And if you are of any kind of compromised immune system too, or elderly.
If you have a chronic illness or elderly small children. We've had 2 deaths of babies in Arizona who couldn't be vaccinated. They were too young. So make sure that you get your flu vaccine to protect us against the virus that's far more common.
Okay, so this is antibacterial, not antiviral.
Does work. Wash your hands.
But we're still okay to clean up.
Clean up, definitely.
Clean up all
there
you
are lots
like.
of other things that can make us sick.
Yes, we're not telling you not to clean up. Keep on cleaning.
Clean up. And airlines, thank you. Clean up.
Yes, please. The most disturbing part of that whole thing was hearing that these are new protocols.
These are new.
Hey, we're vacuuming. Hey,
I don't
we're
know how
vacuuming.
to feel about that.
Dr. Sharon Thompson, appreciate you so much. Central Phoenix Obstetrics and Gynecology. This just into our Arizona Family Newsroom, by the way, at 9:07. Japan closing schools nationwide for 1 month to help control the spread of the coronavirus. You can get the latest on the outbreak on our website, azfamily.com.